This conversation was recorded on the 2nd of June and is with Dr. Heide Castañeda, a professor of anthropology at the University of South Florida. In this discussion, we touch on the biggest issues in legal anthropology and how she applies these to her research on migrant health issues. This includes discussing her latest book, released last year, called Borders of Belonging: Struggle and Solidarity in Mixed-Status Immigrant Families. When the conversation starts, we are talking about the protests surrounding the George Floyd murder and how many of the economic and political issues around the world, while pre-existing before this current social moment, presents a unique product when combined with concerns surrounding COVID-19. So, how's everything? How's everything been during the quarantine? I know it's been a few months now.
It's been a trying time, I think, especially over the last week. You've had an extra layer of anxiety and anger and isolation that's come to the forefront. So I think that's really, it's been a remarkable time, 2020. I'll
Right.
say that. hmm
Yeah. How do you think it's affected? Because your research in like migrant health and like your last book, Borders of Belonging, talking about more about illegality and the the vulnerabilities experienced by migrants. And I don't know if you've been in contact with like some of your former participants and seeing like what this transition has been like for them, or if you can kind of think about some of the things that the vulnerabilities that they already had, now adding
Right.
this extra or these extra layers on top of it. What's that look
Yeah.
like for your research?
Yeah. It's certainly been an extension of the original project in many ways. So I do stay in touch with a lot of participants. I would say probably the majority, um, usually via social media, especially. So in the book, I talk about the experiences of 100 families, and that ends up being, more than one person per family. So it's actually hundreds of individuals, but if you think of them as family units, there's about 100 families, and I would say I'm in touch with, probably at least half of them still via social media. And yeah, it's been interesting to sort of follow them over the years in general, but also in the last months, and to see how things are changing for them and sort of the new things that are sort of emerging, arising, linked to undocumented status, linked to being in a mixed status family. And then again, over the past week, just sort of new efforts at sort of regrouping and thinking about solidarity between
Mm.
different kinds of movements. So yeah, yeah. So how have mixed status families been impacted with the COVID-19 pandemic, and especially with the um, lockdowns and quarantines and isolation that came with it? I think, the really mixed status families in some have been hit the hardest. Um, these are immigrant workers who don't have protections on the job. Um, so they're working in the fields or in the factories. And as we know, there's been a lot of concern about outbreaks in those kinds of settings. In addition, they don't have the luxury of staying at home. They don't have that privilege to stay at home and to not put others in their household at risk.
Mm-hmm.
And then on top of that, they don't have any workplace protections like unemployment insurance. And then they don't have access to the federal programs like the CARES Act that came out. So that's been a really big struggle financially for a lot of families. So it's kind of hitting them on multiple levels. So they have these financial stressors, either of if they have to stay home, which for many of them, their hours have been cut,
Mm-hmm.
or they've been told to stay home, so they're not working. And if they're not working, they don't have access to alternative forms of income. If they are working, they worry about risks on the job and then bringing those risks home to their family members. And then, of course, there's all these systemic structural issues around not having access to healthcare, even if you were to get sick. So it's really hit them on every level. And then on top of that, you kind of layer the mental and emotional health concerns that come with being apart from family, whether that's transnational family or just being, away from people in other parts of the country.
Mm-hmm.
So it's really put a lot of stress on them. So I've talked to a lot of young adults recently, since they tend to be pretty vocal on social media in a lot of ways. And, they talk about, like, even if they're US citizens, and, the book really is about how, just to kind of step back a minute, the book really is about how being in a mixed status family, regardless of your own status, is going to affect you in some way. not always a negative way, but you're going to have some spillover effects of undocumentedness, of illegality on
Mm.
everybody in the household. And so just to give an example, I've talked to people who are US citizens who are, greatly affected by the fact that their immigrant parents or undocumented parents
Mm.
either can't work or have to work in this environment with the pandemic. So it weighs on them pretty heavily, even though they themselves may not be affected. As I said, there's like, uh, people with DACA or people who are undocumented, families weren't eligible for um, the federal relief under the CARES Act. But then you also see other, sort of positive signs, like some I've heard of some universities actually just depositing money in undocumented students' accounts.
Wow.
One person I just talked to yesterday said that her university recognized the struggles that undocumented students have, and everybody in their university who is listed as a DACA recipient just got this blanket $1,500 deposit in their student account
Wow.
just to help them out. So the university, and this is a private university with endowment,
Mm. Okay.
um, the university decided to help them out in that way. And then you also see things like the state of California has been pretty good at providing types of relief and access to healthcare for anyone, regardless of legal status, and including financial relief. So you do see some rays of progressive thinking in this area, but for the most part, these really are the most vulnerable families.
Right.
So
And even in those
yeah,
cases, it's like, I guess, private universities or other entities that are doing it. It's not like codified within like U.S. law to help anyone other than like citizens, and even in some ways barely that. I mean, I know we had the
yeah,
$1,200 checks people
hmm,
got with the first round of like stimulus package, but
right,
since then it's kind of been like everything opened up because there was like a limit on the, I guess, the liability the government maybe wanted to take on by maintaining that quarantine.
yeah,
And
sure,
yeah,
sure. I mean, I have a lot to say about that. First of all, I will say that
yeah,
that stimulus check came with a letter in the mail signed by the president to sort of
hmm,
highlight the fact in an election year that it was to reflect on his goodwill, which I
right,
thought was pretty marked. Another thing I would say is, relying on efforts of private organizations, whether it's universities or, NGOs or civil society in general, is an old tactic to let government not feel responsible for certain populations. So while it's great that the donors to a certain private university step up, or that NGOs offer healthcare services free of charge to undocumented persons, on the dark side of that is it relieves the state of any responsibility for those populations,
mm,
and it allows things, the status quo, to continue. So I certainly wouldn't suggest that they don't do that. But on the other hand, those kinds of efforts are always covering up a larger responsibility in society,
right,
I think.
yeah,
Yeah.
yeah, that's so true.
Um, yeah. And then there
Yeah.
was something else you said at the end there that I was going to comment on, but I forgot. I'll think about it. Um,
uh, yeah, like, do you see, um or in what way do you see like the quarantining linked with the protests now, and sort of the, because you know black men have been shot
mhm,
before in the back even, and that's been caught on video. And
yeah.
we've never had like this level of a response. And I know on one level, everything's now recorded, so maybe that's a
Mhm.
level to it. But like, I wonder if just people being in quarantine, and on the heels of that quarantine, this happened almost immediately after. It's like, I wonder if that sort of exacerbates it. What do you think about that?
Absolutely. I mean, I think I was trying to put it into words earlier this morning. I think there's an anxiety that came with
Mm,
the pandemic. There's anxiety in the sense of uncertainty. There's a massive uncertainty. Again, it's an election year. You've
mm,
got this, unprecedented pandemic that makes us all come together in certain ways, but also isolates us in other ways,
mm,
socially and politically and economically. And so I think people, I think there were a few weeks, maybe even 2 months, where people were willing to sort of come together as a society, come together to stay apart, right? So to come together and
mm,
be part of this project of stay at home. But that's gone on too far for many people, and there's more unrest and anxiety. And I think especially for young adults who've been cooped up at home, getting outside has been tempting, and you can't
Mm-hmm.
really blame people at this point. But I think the larger social issue here is, yeah, there's this underlying anxiety, isolation, and quite frankly, like mass social depression. I think there's
Mm.
a lot of mental health concerns on an individual, but also on a collective level that we're seeing.
Yeah.
And then you introduce something like this, which, I mean, true, in some ways it's unprecedented, but in some ways it's not, right? I mean, I would
Mm-hmm.
disagree. I think there have been huge riots like this before in the 90s, that required the National Guard and you know massive militarization
Yeah.
of the police. And you also have had other incidents, even if you think to the Trayvon Martin case, where people use cell phones. And
Right.
um, you know, I think I think there's definitely something to the fact that this happens all the time. We just don't usually have the video of it. This
Mm-hmm.
isn't the first or last time that we have a video. But I think taken all together, with the isolation and anxiety people have been feeling during the pandemic, yeah, it's made it much worse.
Right.
Um, I think people have also had something different to focus on for a couple of weeks. And then this just
Mm.
highlights this underlying inequality that we all sort of know is there. We don't have to be a scholar to know that's
Mm-hmm.
there.
Yeah.
I mean, even the pandemic, more and more people were reporting on its disproportionate impacts on Black and Brown populations. And I think as that came to the forefront more and more, and we knew more people who were being affected by it, um, and the statistics were becoming more and more clear, it really kind of opened the door for anger, when it comes to other types of oppression, like
Mm-hmm.
with police violence.
Right.
And in the case of the people that I work with, people in the book, for example, they have a longstanding recognition that there's a connection here between um, police violence and immigration
Mm-hmm.
enforcement. And so there's a lot of sympathy, I think, for what's going on. And certainly there's been some effort to kind of, like I said, join those movements or find ways to help, um,
Mm.
which is difficult, right? For undocumented folks, it's hard to join a protest because they themselves are deportable. And so they have
Yeah.
to find alternative ways of expressing rebellion and protest and solidarity. And they're doing that. They're certainly doing that. But I think it's opened up some really interesting conversations.
Right. Something that you've touched on a few times, both within your research and even in the current situation with the protests and everything, is how there's this structure, but also like people are having all these emotions, and like
Mhm.
health is all these different things, like physical, like you have people who are putting themselves out there, like you said, undocumented individuals who ultimately don't have the luxury, or they still have to go out there and put themselves at risk of contracting potentially COVID.
Mhm.
But then at the same time, they're also experiencing these like emotional, mental issues that comes with being vulnerable and maybe having the stress. And it's I don't know how that feeds into the, sort of how you approach anthropology and anthropological research, and you've sort of touched on all these different things that I don't know if you could speak to on how you sort of draw them all together.
Yeah. I mean, I guess I'll maybe start by saying I just saw a colleague of mine, African American professor, who wrote, um, "I'm tired of being resilient," you know,
Mm,
and I think that kind of encapsulates this tension between, as anthropologists, we have to understand communities' vulnerabilities and also highlight their resiliency and their forms of solidarity. And um, that's what I try to do in the book. I mean, the subtitle is Struggle and Solidarity. I wanted to make sure that I didn't portray people in the book as victims, even though they clearly are at the mercy of awful social policies. I
mm-hmm,
didn't want them to read it and read it as if I saw them as victims. I wanted them to read it and say, despite all these circumstances, we have some strategies and some ways of coming together and some solutions. And maybe they're not perfect and maybe they're not long term, but we get through life and we don't need you to feel pity for us,
mm-hmm,
right? I really wanted them to read it in that way, and it was really important to me to send out copies of the book to as many participants as possible, which is what I did, because I wanted them to read it and I wanted them to be okay. I mean, when I wrote it, I wanted them to be okay with it. Um, the point being, we do have to highlight solidarity and resiliency in these things. but at the same time, it's exhausting. It's exhausting for people, and it weighs even more on people's mental health, regardless if you're an immigrant or a person of color or both. You know, it's a daily source of stress, even when it's
Hmm.
a positive stress, even if you're coming together and fighting for justice and showing solidarity with people in your community. Even that is, it's a lot of work. It's a lot of work
Right.
for people, and that weighs heavily on their mental, physical, and emotional health.
Yeah. It,
Definitely.
the sort of being tired of being resilient, I think that was really powerful because I think it goes after this notion of like, it almost shows how it's this thing that's always done and put forward, and people having to be resilient, but it's almost like it's necessary to do it, and it's almost like there's no progress in the grand scheme of it. It's like
Hmm.
resiliency is all you sort of have in the now, and it's not translating into some, like, I don't know, bigger transformation that maybe you don't have to be resilient anymore. It's just like this
Yeah,
weird sort of yeah, like in between state of always just being resilient, and if you're not resilient, then maybe you know things don't get done or thought about or talked about
sure.
as much as they otherwise would.
Yeah, no, and it's true. I mean, I think in some ways resiliency is also convenient for people who don't have that population's best interests at stake, right? The fact that they can
Right.
persist and survive, nonetheless, nevertheless, I
Mm.
think is convenient in some ways. Just like what I said earlier about uh, private organizations or nonprofits coming in and picking up the bill that the government won't pay, right? I
Hmm.
think it's a very similar process where, as long as people aren't dying in the streets, and that's a terrible thing to say right now because they are,
Hmm.
but unless we see, mass tragedy, life kind of just goes on, right? Life goes
Right.
on. There's mechanisms that sort of pick up a lot of the damage, and I think that's kind of what's going on too. And so some of those mechanisms are weighing on people's bodies. They're
Mm.
that resiliency is in people's physical, spiritual bodies, and it's heavy. It's really heavy.
Yeah. Yeah.
Yeah.
It is. And um, right now, like you said earlier, like we're in an election year, and I wonder to what extent, like, people are feeling sort of the stress of what the next 4 years are going to look like, and whether it's under another Trump presidency or whether it's under a Biden presidency. And yeah, it's
Yeah.
interesting to see how all of these things are sort of, maybe they're a perfect storm of things coming and coalescing in the same year. And I don't know what it's been like for you, sort of transitioning everything in the school
Mm.
year, and what's that's meant for your sort of anthropological lens and research and academic career.
I'm still sorting that out. I don't know. I mean, I think there are some positives here. I think that we have seen that certain things can be done remotely. I think
Mm,
that's a benefit to people with accessibility issues. I think that's a benefit
right.
for people who are parents. I think there's, um, that old saying that this could have been an email. Now we know this could have been a Zoom meeting, right?
Yeah.
So maybe we don't need to get in our cars and drive 20 miles to work every day, right? Maybe there are things that we can more efficiently do remotely. There's some positive things I think that are coming from that, and I think people's reliance or expectation of travel has changed. I mean,
Hmm.
I travel is still my guilty pleasure, and I know that I rack up those
Hmm.
carbon footprint miles on the airplanes all the time. But for many people, they've shifted to thinking about vacation using alternative ways. So I mean, just our ideas of travel and the necessity of that carbon footprint has changed quite a bit, I think, in the past 2 or 3 months. But
Right.
on the other hand, we know as teachers, as instructors, that courses remotely or courses online don't have the same impact on students. Students aren't happy with it. Um,
Mm.
I mean, certainly there can be a luxury to just doing something from your home, but at the same time, I think there's a lot of social interaction missing and a lot of physical interaction missing. I think we undervalue the importance of physical interactions in society. So I think as instructors, we recognize that there's certain things that should happen, certain kinds of discussions that happen in the classroom that are valuable to a liberal arts education, to any education. Certainly, I don't know any professor or instructor or graduate student that wishes, or any undergraduate student that, or any elementary school student that wishes for this to go on.
Right.
Nobody wants this to be the new normal.
Yeah.
But there's a few things we may have learned that are helpful, but at the same time, I think everybody's waiting for a return to normalcy, whatever that looks like. Um, and hopefully the new normal is new. Like, I think one of the fears I have is that we go back and things are the same as they were
Mm.
before.
Mm-hmm.
And if nothing else from this current moment, whether it's the protests in the streets, or the staying at home, I think or the lessons of the public health lessons of dealing with a menacing virus. I think if nothing else, things shouldn't go back to the way they were. I think we were learning a huge lesson here.
Mm.
It feels like we're
Right.
living in a film.
Yeah. Yeah, it really does. And the lessons that we can learn from it, I wonder, I guess this touches on like what it's looked like for different people. Like a lot of people are out of work. A lot of people ended up, um, yeah, like our unemployment rates have skyrocketed and
Hmm.
rates that we never seen before. And like, what does it mean to transition for everyone, right? And it makes me think about your research and like in terms of, I guess when we think about undocumented uh, migrants who are working, whether they're working in uh, the fields or whether they're doing other types of work, they've like been it's like been agreed upon by everybody. Like they were considered essential workers, but then there was also a lot of concessions given to farmers. It seems like that President Trump wanted to make by allowing them to pay their workers less.
Hmm.
So
Hmm.
I don't know what you think about that in terms of the kinds of things that are transitioning for us versus that population, as well as maybe even seeing what kind of increased and additional vulnerabilities that they might be seeing because of legislation that wants to sort of make it easier for everybody else.
Hmm. Hmm. Yeah, no, that's a tricky question. I do think they are considered essential in many ways, but again, I think their working environments have not changed. I mean,
Right.
we know that in addition to meat processing facilities, that farms are an area where we're seeing hotspots around the country, where people, because they have to take buses to get to work, or because of their living conditions, um, and certainly because of their designation as essential employees who have to keep working, often without any protective gear. Yeah, they are at much higher risk of exposure to anything,
Mm.
which probably isn't terribly surprising. I think on the larger scale, though, I think too, Americans, or people around the world, not just Americans, people around the world are recognizing the fragility of our sort of capitalist system. I really feel like
Mm.
it's hit home in new ways, not just for the farm workers, but I think for even white collar workers who have had to stay home or who have been furloughed. They're feeling now how unstable the basis of our economy is. And it's
Mhm.
unstable because of the exploitability that we've built into it. And as
Right.
soon as certain people aren't able to pay their mortgages or their rents or feed their families, the whole thing collapses. And I
Right.
think we're just barely starting to see that. So we know now that there's been a big rise in evictions, for example, right? And we're
Mhm.
just seeing the first wave of that right now. But I feel like as a society, we're seeing the fragility of that economic system and that labor system, especially
Mm.
firsthand right now. I mean, if a third of Americans are out of work, I don't know if that's not a good figure, but about 30% unemployment this month, right?
Right.
So, what does that mean? It means it's touching everybody, and everybody's sort of thinking about the kinds of jobs they have and the stability
Mm.
that comes with it.
Mhm.
And that it's a uh, potentially it could be a moment for a revolutionary change of some
Mhm.
sort, um, or complacency. Kind of depends on what happens next. And I think
Right.
some of that anxiety is again what we're seeing in the streets right now. I think people's frustration is definitely about police violence. There's no doubt about that. But I think there's a lot of other things going on, a lot of underlying uncertainties and anxieties and rifts and you know dissatisfaction with their position in the social hierarchy that is coming
Mhm.
forward as well,
Yeah.
right?
when you
And
think about, yeah,
mm,
I guess like when you think about the entirety of the structure that we're talking about, it's like, right, um, police brutality, mass incarceration, all the things that may impact only certain groups of our population. But then we also have the fact that people are out of work. Maybe there's less
mhm,
opportunities for personal and economic and professional advancement. And one of the things I thought was interesting was a student from the grad program here was talking about some of their experiences with protesting in Tampa and
mhm,
near the university area. And I thought it was interesting that they noted that the police were mainly defending the property of like businesses like Walmart and Target and a few others, and the small businesses were the ones that were most affected, mainly
yeah,
because the police weren't there and the police weren't there in force. And I think that's another thing is like when we think about, I guess, this whole structure, it also does privilege money and it privileges
mhm,
those corporations that want protection. And ultimately, in some ways, like the police are the protectors of private property over a lot of other things, a lot over people and over the good of a community. It seems like,
mhm. Yeah,
but
I mean, and to sort of build on that, I think the pandemic showed us that that's what it's really about too, right?
right,
Reopening economies is more important than protecting lives. Now, I am not the person to say we're looking for no circulation of the virus to begin our lives again. I know
mm,
that there's a threshold, there's a point that is sort of ideal, but we never reach that ideal point. And I think that's the
mm,
consensus right now is right, we're just kind of playing loosely at this point with the virus and people's lives in the interests of business, right?
mm,
Essentially in the interest of the economy. And that's striking and kind of goes back to what you're saying that the often the larger goal of the government or certainly the current federal administration has been to protect business or to protect the economy over lives and certainly over the
mm,
lives of people who are marginalized. I think that's
mhm,
really clear. And I think a lot of people see that now. And I hope that people see that more clearly now because they're directly affected and they're witnessing history firsthand in that way. Um, of course, it
mm,
doesn't always work out that way. Sometimes it ends up pitting groups against each other, right? And you see
right,
that happening as well. Um, but I do
yeah,
think I think just to kind of to link those two events together again, it is striking the amount of resources that are being deployed right now to control populations who are in some form of rebellion,
mm,
peaceful even,
right,
not always, but often, and compare that to the response to the pandemic and the utter lack of willingness to deploy any kind of resources in that setting
mm,
really says
mhm.
a lot.
Wow, it's like resources are deployed just to put people back into their, I don't know, like cages, I guess, for lack of a better, like, yeah,
Yeah, back in their
comparison.
place, their social
Yeah.
place, right? I think that's happening really clearly, and people are seeing that, and that's outrageous too. How you can not deploy the National Guard to even, I mean, to even test people
Hmm.
um, uh, for this virus. And I know there's reasons why they're not. There's beyond that. There's reasons why covering up numbers is very helpful, but
Hmm.
just the utter lack of willingness to deploy resources for that situation and save lives,
Hmm.
and instead use them to, uh, yeah, forcefully, militarily put people in their place, which is what we're
Right.
seeing right now.
Yeah. It it almost reminds me of, at least for a second, about like the hurricane striking Puerto Rico and
Hmm.
the president's response. Like, first of all, questioning, like, saying that Puerto Rico is like not even linked to the U.S., so there's like a lack of understanding of that. But also, yeah, just prioritizing and maybe minimizing the importance of utilizing federal resources for helping people, whether it's through providing like direct aid and assistance through something like a tragedy like a hurricane versus a pandemic, which
Yeah,
they're all pretty, yeah, I think they all
right.
sort of seem to scream the same thing, which is that there's a sort of an unwillingness to really use federal resources for helping people.
Yeah, yeah, and just putting the onus of responsibility on individuals, and the
Hmm.
public good becomes the marketplace instead of things like safety or public health, right? I mean, it's just a
Right.
displacement of priorities. I think that again, many people are seeing firsthand now, and what they do with that will be quite interesting because it's ultimately it's a political issue at its
Hmm.
very core.
Yeah, it really is. And I for the next sort of school year that's coming up, um, I don't know how you've sort of been preparing. It looks like USF has released exactly how they're planning to do it, and I guess like by the time Thanksgiving hits, everything's online. But that's only like a week of school left. But
I
everything
would
seems to be going back to normal.
I would be cautious in interpreting it that way.
Right.
I think there's also another message that's sort of underlying some of this. It's not contradictory, but I think it's
Hmm.
important to note that there are priorities being set for which classes will be held face to face and
Hmm.
in person. So I wouldn't make an assumption right now that things are back to normal.
Right.
I think there's two things going on here. I think one is many universities have seen the benefits of planning for essentially a shorter semester,
Mm.
not because it's shorter, but because people's travel plans around Thanksgiving time might facilitate the virus spread. So I think
Hmm.
there's something going on there about the schedule. So on the one level, there's a scheduling issue, which is basically front loading a lot of material. Sure, there's one more semester, one more week of classes after that, but essentially what they're saying is you're going to shorten the semester. But then there's another layer, which is they're currently strategizing, not just at USF, but at lots of places, which courses need to be held on campus in person. So I
Hmm.
think it would be safe to sort of expect another announcement of that. And I think all along, a lot of us who have been, who know something about viruses and public health and who are generally a little more cautious, have been thinking that planning for remote instruction is probably a good idea.
Right.
So,
Yeah, it's interesting. Thinking about what people hope to get out of university experience, students, and
hmm
remote instruction sort of being in conflict to the experience people expect to get in university setting, especially like freshmen who are
sure.
coming to this for the first time. And I guess it speaks to, I guess I'm thinking about the seniors and the people who graduated this
hmm
last semester, and it just seems like everything's geared towards in person, being in really large gatherings, that um, it's just what it means, I guess, to like change things and tailor it towards maybe remote instruction and remote meetings will be interesting, just because
Yeah.
everything's already set up for face-to-face interactions, and people feel like they missed out on getting to graduate. Like
hmm
that's such a huge you know
It's
valuable thing
huge.
in people's lives. Yeah.
Yeah, and I mean, a lot of the undocumented folks I work with graduated, and to them it was like one of them described it as like this double blow because they never even really knew they could go to college, and then they went to college, and then they graduated, and then they went to graduate school, and then they were getting
Mhm.
their graduate degree um, last month, and just feeling like it was all kind of anticlimactic at some point, right? It was just sort of
Mhm.
like, there was no celebration. Her family couldn't even be there because they were in another state.
Mhm.
Um, just feeling like you'd been the first in your family to do something, and it couldn't even be celebrated. I mean, it was like
Yeah.
doubly tragic, not just for her, but for a lot of students for whom this is a major milestone, whether
Right.
it's a graduate or undergraduate degree or a high school degree. I think for a lot of students,
Mhm.
they kind of got robbed of that experience. I think there's a lot of understanding on why that is, but it certainly is a generation of
Mhm.
graduates that is having a whole different experience about
Yeah.
school.
Yeah.
Yeah,
Yeah.
so
And
it's definitely.
in, in terms of I guess your research, I guess, like what kind of like anthropology would you say that you're involved in? Because I know that you
Mm-hmm.
work in like legal anthropology and
Mm-hmm.
migrant health, and I guess like I've been really fascinated by like legal anthropology and some of the articles you've written regarding that, because I think when it comes more to that, I personally feel like I'm sort of lacking in that, and so I think that's part like a big
Mm-hmm.
reason why I think is really interesting, because there's a lot of things when it comes to the legal system that would benefit a person to know in order to navigate it and to be able to study it, especially as an anthropologist. And I don't know how you could explain like how you sort of got into it, what kind of like
Sure.
questions you sort of approach that with it, and maybe even how you define that field for yourself.
Yeah, yeah. I mean, I guess the one way I sort of approach it is, when people hear law or policy, it sounds kind of boring and dull and bureaucratic and um, like something that's, written on paper and then is dusty on some bookshelf somewhere.
Mm,
And the way I like to think about law, and I think the way a lot of there's a whole field called, law and society or law and social sciences, which takes a social science approach to law. And essentially, what it's saying is that the law is a living entity in many ways. That
mm,
it's constantly changing, and most importantly, it is interpreted by and affects groups in different ways. Right. So I think one misconception about law and policy as well is that that there's something black and white, and somehow that gets translated into, for example, equal treatment.
mm,
And it turns out that's not at all the case, that the law is incredibly open to interpretation, incredibly open to bias. You can take the same three or four words of a legal statute and apply it in different ways. And I
mm,
think that's what's fascinating to social scientists, is the fact that what appears to be a neutral institution is actually not at all that, and that
mm,
it's
mm,
historically been used to marginalize people, currently is used to marginalize people. It benefits some groups and entities and institutions over others. And I think that's ultimately where the interest in law and policy comes from for an anthropologist or for a social scientist in general. So you can take a specific law and trace its effects, right? So
mm,
one of the laws I've looked at is the Affordable Care Act, which by all measures was meant to be inclusive and progressive, and well, not by all measures. We know historically that it kind of came out of an idea of um, including the private sector, of prioritizing the private sector. It had nothing to do
right.
with universal health care. It had to do with privileging, certain insurance companies ultimately. And so,
Mm,
you know, you could take a law like that on its surface seems very progressive and very fair and very inclusive, and look at how it sort of uh, applied differently to different populations and who was disadvantaged and who wasn't. And what other social effects did it cause? So a couple of things that we mentioned in the book we wrote on the Affordable Care Act, the book that I co-edited with Jessica Mulligan. A couple things we mentioned is that it just sort of intensified this American idea about personal responsibility, about
mhm,
individuals being responsible for their own health care. So it was kind of the opposite of universal health care, because it said, if you as a person don't take responsibility, we're going to fine you. Right? It's not the same thing as including people in a universal system. It also increased things like accountability and auditing cultures and things like that, that are sort of systems of the state to monitor people.
mhm,
So it had really interesting effects. So you can do that with law and policy
mm,
and the analysis thereof. You could take a certain law and do that, or you could look at systemic issues. So one issue we've been talking about is police violence, right? And so
mhm,
you can look at, and in fact, a large number of law and society scholars look at policing. Policing
right.
is like probably the number one issue that people look at in this field. The second maybe is sort of judicial issues around jurors and judges and sentencing and so forth. So there's some really interesting things that kind of come up there when you look um, at different communities in the United States, for example. And the way that I've
Mm,
looked at this issue, so a lot of my work is actually on policing. It's about immigration, but it's actually about policing and
right.
falls within that realm. Just looking at how different communities are policed or surveilled. Um, in my case, often in border communities where the majority population are brown people or Mexican descent, Latinx groups that are, because of their geographic location, more vulnerable to policing practices.
Mhm,
So yeah, so all of this kind of comes together in an analysis of the law and of how you interpret law and policies, and the administrators of law, whether those be uh, persons in a police uniform or judges.
mhm,
There's lots of interesting angles I think that anthropologists and social scientists can look at.
right.
But the first key is just looking at law as a social construct. and a historically embedded social construct, and playing with that idea.
Yeah, that's pretty cool. And
Yeah.
um, like that practice of sort of tracing a law's effects, and like on the one hand, I think when people think about the laws, like what was the intention behind it, and what caused it, and everything. But a big part of it is the effects of it, and
Hmm.
maybe people who wrote the law didn't have the explicit intention of, let's say, like marginalizing a certain group. But
Sure.
if that's the effect, it just seems like that that kind of study would really get to that, which would
Yeah.
then nuance it and everything.
Sure. I mean,
Yeah.
a lot of studies are about that disconnect, exactly that disconnect. Even laws that are really well intentioned end up having
Mm.
negative consequences or excluding certain groups, right?
Right.
So, yeah,
Mm.
so we've seen that in healthcare law and other types of places as well. So, yeah,
Yeah. What's that
definitely.
saying? The road to hell is paved with good
With
intentions.
good intentions. Yeah. Yeah, exactly.
Yeah. It's so, yeah.
Yeah, we did a study here in Florida where we looked at dental Medicaid. So it's the state of Florida will pay for dental services for children on Medicaid.
Mm.
And when that law was passed, policymakers thought that was fantastic, and they patted themselves on the back for being, so thoughtful and
Mm.
including access to dental care for children who are coming from underserved families. And what we traced was how that law ultimately led to dentists not getting paid enough and therefore not wanting to take on any of
Mm.
these children.
Right.
And since most of the children who were disadvantaged were also, for example, Spanish speaking, there was another layer of problem why dentists weren't taking them. And so we did this study where we looked at how what seemed to be a good law was actually um, you know, Florida has was rated by the American Dental Association as a grade of F with
Wow.
dental care access because of this,
Wow.
because they had done something that they thought was really good, but they weren't, as part of the law, they weren't compensating the dentists enough.
Mm.
They were just being too cheap about it, and it created this situation that made it actually a lot worse.
Wow.
So
That's
yeah,
really unintended consequences.
yeah, and
Yeah.
there was a
Big
lawsuit,
part of it.
and
Yeah.
that's something anthropologists can help with.
Yeah. And I wonder how, because you've also done a lot of research in other places, like in Germany, and I
Hmm.
wonder if you could sort of touch on like what the research has been like in other countries, whether it's what you're doing, but also like what the experiences are with the systems that you've had to deal with, and how you've sort of
Sure.
had to adapt to them.
Yeah, sure. I mean, I remember going to Germany to do my dissertation research, and it was on healthcare access for undocumented persons in Berlin. And every meeting I had with like stakeholders, the first thing they would say is like, "Why are you here studying this issue? Why aren't you back in the United
Mm.
States where there's 40 million people uninsured? Like, why?
Mm.
What do you hope to gain by studying Germany?" And it was back to those unintended consequences. Ultimately, Germany has a universal healthcare system,
Mm.
but it has very strict sort of paperwork requirements, such that um, first of all, there's strict paperwork requirements so that undocumented people who don't have papers have a hard time getting into that system.
Mm.
And second, it had another law that prohibited or actually punished medical professionals for treating undocumented persons because it considered that to be a form of aiding
Mm.
them in their illegal residency in the country. Right. So
Right.
by treating someone who is really sick, you're aiding them in their illegal residency.
Mhm.
So that was the law that I was actually following at the time. And so, needless to say, a lot of people didn't know about that law. The law was actually never really utilized. I mean, I've heard of very few, if any, cases that were pursued under that law. But what it did is it created an environment of fear for physicians who did know about it. They would say, "Oh, I
Mm.
don't want to get involved," right?
Right.
So then you have this environment where the state has now outsourced the policing of immigrant bodies to the physicians, right? Because the
Wow.
physicians can say, "Well, there's this law, and I don't want to get in trouble, right? And therefore, I'm not
Mhm.
going to treat you." So you do see this is another example of how laws kind of play out and the impacts it might have on vulnerable populations. So, but in this case, dealing with the German healthcare system, a lot of people just say, "Well, why are you here? We have a great healthcare system.
Right.
We're universal, we're inclusive," and to some degree, that's true. Certainly in comparison to the United States, but didn't mean that there weren't other issues happening. So yeah,
Right. Wow. That's really incredible. It's like, yeah, the bureaucracy is extended to include physicians who ultimately don't want to, suffer penalties by
yeah,
treating someone that, I guess, the government sort of decided would be aiding them
Right.
just by offering them healthcare.
Right,
Yeah.
right. So physicians become gatekeepers for immigration policy in a lot of ways, right? And that we see
Right.
that in other places, like for example, where asylum seekers require medical exams. And so if the state is requiring medical exams, then the physician who is conducting those medical exams becomes an agent of the state and helps in
Hmm.
determining whether or not an asylum seeker or a refugee's case
Hmm.
is successful or not. And so there's a lot of ways in which medicine kind of becomes complicit in these sort of state
Hmm.
activities, especially when it comes to immigration. And so this
Right.
is just another example of that.
Wow. And your book, Borders of Belonging, begins with a story of like a woman who's giving birth, and their child seemed like, they wouldn't allow the father to be on the birth certificate because he didn't have his ID at the time. But as soon as he came back with it, supposedly they did it, but then they later found out on the birth certificate itself, it looked like someone had whited out his
Hmm.
name. And it's incredible because it's sort of another case of like seemingly like healthcare or public health like sector, at least in a certain place, being sort of a gatekeeper in some ways, but ultimately actively
Hmm.
sort of shielding a child from ultimately having its father on its birth certificate. I don't know if you could speak to
Yeah,
that, because that seemed like a really
sure.
incredible sort of case.
Yeah, and in this case, the father was a U.S. citizen, so there would have
Right.
been resources attached um, to that declaration of parentage and so forth. So, I mean, it seems like okay, maybe it was a mistake, maybe somebody made an error, maybe it wasn't really white out,
Hmm.
maybe the person who
Right.
filled it out didn't know right. But this is exactly how um, these kinds of disentitlements work, right? And to get
Hmm.
back to the issue of racism, right? There's, microaggressions work because they're not overt, because they don't seem to
Hmm.
be systematic. They seem to be like, well, maybe it was maybe I heard that wrong, or maybe the person just made a mistake. And I think it's the collection of
Hmm.
all of those kinds of activities that seem small, that really lead to the big picture of disentitlement that people experience. And of course, when people speak out about it, they're told, well, you're overreacting, or it's, no, we have a law in place that protects you from that. And that's not
Hmm.
true, right? Because ultimately, it's
Hmm.
the the bureaucrats that interface between the law and the people that they serve that have the power to make these kinds of small actions that can either help or hinder a person in life. And so that's a
Right.
good example of that.
Wow. Yeah, it's really
Yeah.
incredible. And
Mm,
yeah, wow. I
yeah.
I think as we look at sort of everything that's happening right now, it's just we're seeing a lot of cases of people sort of reacting to the ways that their lives are being hindered or in some ways affected. And I think that's one of the interesting things about like the way people are reacting to like looting and
Hmm.
people setting fires. And it's like sort of like you're allowed to be and express your anger in a certain way. And if you're stealing, then by definition, you're sort of taking advantage of the situation. And um, I don't know. It's one of those
Yeah.
things that's it's kind of hard to. It's easy to cast judgment and to say it must be this if this is happening, because that
Hmm.
a lot of
Hmm.
that seems to be going on. But I wonder, yeah, like what taking a step back and really looking at it, um, what would it look like? It's
Yeah.
a really cute cat, by the
Oh,
way.
that's Loki. He's gonna
Yeah,
come hang out, I'm sure.
yeah, yeah.
um, yeah. I mean, I think the thing about like you know, police violence is you could get all wrapped up in that specific case. You could say, what exactly happened in Minneapolis? Let's look at all the
Hmm.
body cameras and look at all the footage and do an autopsy and find out where somebody made a mistake. The problem is, and you
Hmm.
can do that all day long, and the majority of Americans would participate in that exercise.
Right.
Whites, doesn't matter, political spectrum, they would agree, okay, something went terribly wrong here. Where people start to break apart is in recognizing it as a systemic issue, right? The
Hmm.
fact that sure, in this one case there was this one little mistake made, maybe a huge mistake, I should say, but you have to see the broader pattern to understand why people are angry, right? It's
Hmm.
not about it's not really about this one person. That's just the tip of the iceberg, right? It's all of the other sort of systemic things that have led up
Mm-hmm.
to this, and people recognizing that this is a pattern. And if you get too focused on the one specific case, then yeah, of course it's excusable. Just like the bureaucrat that whited out a name, right? You can say, well, it
Yeah.
was probably just a mistake, but it's the systemic issues that I think are key here,
Right.
and and that people, interpret in different ways, right? Looting's fascinating, a really
Mm-hmm.
fascinating activity. It's an expression of power by the powerless, right? It's not about,
Mm-hmm.
oh, they're going to go, break into the sports store and get some sneakers or something like. It's not about that. It's about an expression of power for people who don't have power.
Right.
And interesting things happen when you get people in a group, and so it's easy to sort of sit back and look at it from that perspective and judge. But I think you're missing the history, you're missing the systemic issues, and you're missing
Mm.
the collective anger that really drives a lot of that.
Right. And something you were touching on a little bit earlier was like the sentiments of like, uh, I guess something that I've been more interested in is how like emotions and the feelings that people have within a certain social group, um, how impactful they are. Because a lot of the times we tend to consider discrimination and racism as being systemic, at the same time being invisible. And in a lot of the research I'm doing right now on, let's say, disability studies, like disabled people are considered like the largest, like discriminated against group,
Mm,
because they go places, a lot of places aren't really tailored to wheelchairs or what have you. But then at the same time, something that my brother was telling me was how like sort of going to a place like a dentist's office gets a lot of stares and a lot of
mhm,
people get uncomfortable, and maybe no one's saying anything, but that discomfort is still palpable.
mhm,
And I guess more broadly in terms of discrimination, I can only imagine, or I can imagine like how pervasive that can be in some people's lives, maybe not everybody's, but to go into a place and to just feel the tension there. No one ever says anything to you. Maybe people don't even look at you, but you can still feel it,
mhm,
and
mm.
maybe people do stare. And I guess that element that we often consider to be invisible and something unjustified to sort of react to, I think that's the thing that really is interesting to me
Yeah.
in terms of the two ways that we can look at discrimination and systemic racism.
Right, right. And as you said, it's like, how do they say, you know it when you see it.
Hmm.
It's like, I don't know. I guess I'm thinking about like, um, I don't know where that's from. I think that was about discussions of obscenity, and like, you kind of know it when
Oh,
you know it when you see it. Like it's
right.
like you can't label everything that is offensive. You can't list them on a paper, black and white, but you know it when you see it. You know when there's something wrong. It's
Right.
a gut feeling that we have as humans, and I think especially for people who are in situations where they are made to be feeling marginalized all the time, they know it when they see it, right? They you
Hmm.
don't, I think this is a case where a person's uh, experience tells them everything, and so
Hmm.
it's a really good example, right? And that's why discussions of inclusive spaces are important, but they sometimes are too surface level, because
Hmm.
yeah, you can have accommodations for people, you can give lip service to diversity and inclusion, but people they know it when they see it,
Mm.
right? They know it when
Hmm.
they see it, and they know it when they don't see it. And I
Right.
think that's the other piece of it.
Yeah, that's such a good point. Um,
Yeah.
in terms of, I guess, your research, like what
Mhm.
does it look like moving forward right now? Like, what are you focused on right now?
Well, I've got a couple new projects going on in Morocco, North
Hmm.
Africa, along with my colleague Tara Duval, who's
Right.
worked there for a long time. And one thing we're focusing on migration. We're looking at migration and gender and religion and a couple of other aspects. But one thing that we're really excited to look at too is race. We're looking at how race is how it's discussed, its history, it's how it's experienced in a place like North Africa, where there's pretty clear distinctions between people who view themselves as, you know, African. There's Africans, and then there's Africans, right? I think there's
Mm.
people have talked about this in a number of different settings, about how there's like other others and real others, and how there's nuances to this idea of discrimination and race and ethnicity.
Yeah.
Certainly, I've seen it in places like Germany. Certainly, we can talk about it here in the U.S. context in different populations, but kind of understanding some of those nuances of how that operates in a different setting
Mm.
is something we're excited to look at as well.
Yeah.
Yeah, and in the context of migration, especially.
Yeah. That definitely
Um,
is interesting. And I guess it makes me think about something, which is that, you know, how do we view diversity? How do we view culture and cultural diversity? I think there's an assumption here in the US that we have a culturally diverse populace, and I think that's less true than people really think it is.
mhm,
Like,
mhm,
just because a person looks different, we imagine that they have a different culture, but that's not
mm,
necessarily true. Like, they have a different cultural
yeah,
experience, embodied experience, but ultimately how we define culture seems very surface level itself. And
yeah.
yeah,
It does. I mean, and it's linked to issues of things like citizenship and language and other things as well. So when we talk about race and ethnicity, there's all these other layers, and I think a really good example is um, most Americans think that people who are Latinx or Hispanic, Latino are immigrant origin. Either they're immigrants
mm,
themselves or they're first or second generation, and that's absolutely not true.
mm,
And I
mhm,
think that is a linking of ideas around citizenship, around race, ethnicity, and nationality,
yeah,
language, certainly language. All these things get all kind of tied up together to produce othering sort of practices, um, and a lack of recognition that people are, born and raised in the United States generations deep, and that
yeah,
even language, that Spanish is a language of the United States. There's no question
mhm,
about that. It consistently gets classified as a foreign language, even in our own university. It's a world
yeah,
language. It's a foreign language, and it's not.
yeah,
It's a native language for Americans, right? So things like that get wrapped up in other discussions of race and ethnicity really conveniently, right? And I think that's another piece that people don't talk about very much.
yeah. That's such a good point,
Yeah.
especially considering like I've met families who like they trace their origins to like when land still belonged to like Spain. Like it wasn't
Hmm.
even you know belonging to the US. Like their
Hmm.
families preceded that, and
Right.
that's so interesting because it's like, how do we define legitimacy? Is it
Yeah.
because of who purchased the land, and are settlers from like the colonies who came on the land more legitimate than the people who were already there? And then
Right.
that you push that back even farther, thinking about Native Americans, and like, how do we define like true citizenship, or like
Right.
pure unadulterated, you know, American? Like, how do we define that?
There's no such thing. And yeah, but it's
Yeah,
not inconsequential, right? It's not
yeah,
trivial, because it is linked to things like citizenship rights and property ownership and voting rights and so forth. And I know you
mm,
teach cultural anthropology. You've probably used some of these films in your class too, where you see some really clear, census practices and Supreme Court decisions that define not just citizenship, but define whiteness as the criteria for citizenship, and
right,
that's
right,
changed over time. And so, this is part of that process of legitimizing certain people's Americanness over others. Yeah.
right. Yeah, that's so true. Um, so I don't know if you have like any sort of last comments, words, or sort of thoughts that you like to share.
Wow, that's a lot of pressure.
Yeah,
No, I don't. I don't. I mean, it's just we're living in an interesting moment. Everything's
yeah,
moving right now. It will be
yeah,
so interesting to look back, and this will be, a chapter in history books, 2020. I think many of us have not. Um, it's just time full of anxieties and tensions,
mhm,
and it's really interesting to see what's going to happen in the coming weeks and months, really,
yeah,
and to see if we restructure some things in our society or not. I think it could go either way. I think the fractures and ruptures in society have been pretty evident,
mhm,
and the
mhm,
question is, what do we do with them now? It's an
right,
election year. Things are supposed to get quote unquote back to normal at some point. People are supposed to get back to work at some point. But what do we do with these fractures and ruptures? And that's where anthropology comes in, because that's what we do best, is we look at fractures and ruptures, and see
mhm,
what's really happening, and
right,
how things play out. So yeah,
yeah, yeah. That sounds really awesome.
yeah.
Well, thank you so much. I really appreciate getting to talk to you.
Sure, likewise, likewise. Thanks for inviting me.